Welcome to the Generous Benefits Podcast, where we talk about building benefits that actually help people and still make business sense. I'm your host, Amanda Brummitt. Today, we're digging into mental health in the workplace, not as a talking point, but as a real cost driver, a retention issue, and honestly, a humanity issue. Our guest today is Billy Schroeder, a licensed professional counselor and co-director at Just Mind Counseling. Billy has a really valuable view of the world. He works with employers who are trying to support their teams, but he also sits across from employees who are just trying to hold it together. So he sees where the gap is. We're going to talk about why investing in mental health isn't optional anymore, what happens when companies don't, and what good mental health support actually looks like. Let's jump in. Well, Billy, thank you so much for taking time to be here today. I would love it if you could start with just telling everybody who you are personally and professionally.
Well, my name is William Schroeder, or Billy. I am originally from New Orleans and I live in Austin, Texas now. My wife and I own a counseling practice here. We're both therapists and we have over 50 therapists that are working with us and a couple locations in Austin.
Amazing. And it's called Just Mind if people want to go look you up.
That will be an important point. Thank you. Just Mind Counseling is the name of our practice. And we've been around in Austin since 2007. And we work with kids through adults. We work with pretty much everything. We have a lot of very experienced professionals with us. So we're really, really lucky in that. And we take some insurance and we work with big employers, including like Deloitte.
Yeah, fabulous. Well, and Billy, part of the reason why I think you are the perfect person to talk about this topic is because of the work that you do with employers, but also you know what it's like to sit across from their employees. And so can you start with explaining why employers should care about mental health and what happens if they don't?
Yeah, absolutely. It's an interesting thing. We were actually just working with some actuaries for a new company here in Austin called Harbor Health and looking at the justification of like, why should a company invest in mental health? And even like looking at it from the perspective of an insurance company, because they're creating an HMO. So we actually went and started digging into that data. And repeatedly, you see these examples of how companies that invest in mental health are saving money. Some of that data is coming from companies like Milliman, which are paid to do a lot of research on that. There's companies like Kaiser. There's Cigna Evernorth, and there's showing, savings that are thousands of dollars per employee. You may wonder in a simple way, what does that mean? It means that you're ultimately, by focusing on mental health, you're helping to keep people out of the emergency room, which is a huge cost driver for so many different people. Also, it helps them from an employer's perspective so that they're not missing work, because you want your employees to feel happy, productive, and, like all of that stuff. It helps to also prevent like recidivism and, problems from occurring again. Because inevitably in life, there's so many different things that come up, whether it's, stress about relationship or kids or whatever it may be. And all of those things can be factors that cause people to potentially not be as productive or to miss work. I know that those are the things that appeal most to employers to look at, just because mental health as a cost item, you may not see that immediate return, but it's that reminder that this actually is there. And when you look at all of this data, which Amanda, are you going to be able to share any of that data with people?
Yeah, I actually think you did too much research not to. So yes, I will absolutely drop that in the show notes so people can go read it all themselves.
Yeah, it's absolutely fascinating. So, I would encourage you, if you want to look and see what the hard data is and like why it's important to invest in these things. And as an employer, you can look at this in the examples of like if you have like quality EAPs for your people, because that way it's like for many large employers, you may be self-funded or things like that. So you're looking at like, how do I keep those costs down? But a lot of people are also concerned with EAPs because very often they're kind of throwaway EAPs is kind of a term that I've heard, in that you get people that are not really well trained. Maybe they haven't been around a while. So that's why getting corporate wellness programs and or just quality EAPs is really important.
Yeah. So Billy, let's back up a little bit. You talk about that ER visit, and an ER visit itself is very expensive, especially compared to a few couple $100 therapy sessions. But in that ER visit, are you thinking medical issues like unmanaged stress, and now I'm having a heart attack, which is going to cost your company hundreds of thousands of dollars? Or are you thinking like a mental health crisis where we end up with an inpatient admission or an overdose? Like, what can you share with us to put some color on it?
It can be all of that, right? I mean, you think about the different scenarios that come up. It could be, you know, a teenager that's part of a family that inevitably is having some struggles, whatever it may be. Even the best kid has ups and downs, and those things can, look like body image and food issues that may result in an eating disorder, and they, may have some suicidal ideation that potentially comes with that. Maybe they don't. Hopefully they don't. But those things also, like whether that's directly covered by that health plan and trying to help that kid when they're in need, but also looking at the additional cost on that family. Because if that issue hasn't been supported as a mental health thing, inevitably there's like the ripples that kind of go through the family. Another good example, actually, to kind of, I guess, give that perspective, Mark Garza is a guy here in Austin that started up something called Flatwater Foundation. And Mark had started this thing up for cancer just because he had noticed himself, he was like, as his cancer affected his family. And I connected with Mark years ago just because my own father was diagnosed with cancer.
Hmm.
And so I wanted to see how we could potentially partner together. But the premise of Flatwater was inevitably, we go through these times where cancer goes and has these different ripples that affect all of us. And, it was a reminder in his experience. And so we started this up to be able to support those families. So that way, let's say a parent has cancer and it's terminal, to then be able to supply care for them and, to be able to give support not only for that individual that has it, but for their partner that's caring for them and for their child. So that way, if there is something that's, terminal in nature, that they can have support around that and have something that feels, as hard as that is, feels supported through that process. And so that's a really, like, I think, broader example, but no doubt when you look at kind of all the things that can come up, you never know the history of your employees. You can have the most high functioning person on the planet on their surface because they're very driven. That may come from some stuff in their past that was really kind of bad. You never know when something has been more challenging in somebody's background. Like I always, as a therapist, it's always so humbling because you can just never assume that part of like, who has had extremely challenging situations, whether it's, a parent that died by suicide or whatever it may be. But inevitably, those things are mental health, issues that can require support and can help that person. And as we go and like focus on those different things, we can help to then bring down the cost drivers that can come from that. Because we think about like if somebody ends up going on, leave because of a mental health issue, as opposed to them getting support, and then maybe it trickles down, into from going every week for a little bit to every other week to once a month. And then, things get better. I think so often our health system, and actually many health systems around the world, have focused on how do I prescribe the medication for this issue?
Yes, so good here.
Yeah, it's this focus on like a very much of a one to many, like, approach that's very impersonal. Problem being that, like it's interesting, there's data in The Economist, and they were talking about how the health system there in the UK has looked at how many people tend to be on these medications for many, many years. And as a result, they're also never trained of when do you get off of them. And so as therapists, part of what we try and do is what we try and do as therapists is teach people different skills so that maybe they don't need those medications in the future. Maybe it helps lift some of the fog of the depression that's happening in their life and gives them the skills to better cope.
Yeah, definitely. Okay, I want to come back to that in just a second. But before I do, just kind of wrap up this first topic. What I'm hearing is you're going to pay for it one way or another. So you can do it proactively through good mental health care, or you can do it reactively when these big claims hit your health plan. So just going off on a little bit of a tangent, what you were talking about with medications, I think that's something that people don't understand. They don't understand that you go to a psychiatrist or maybe your PCP for medications, and then you go to an LPC or a social worker or a therapist for therapy. Sometimes those play together, sometimes they don't. Can you give us your elevator pitch on how that should work?
Well, the hope is that all of that's connected. And as an employer, I think it's helpful to look at different places that do have all of that stuff in-house, because there's a greater chance for that to be connected, and or that they encourage that collaboration between those different disease. And I think more and more as we go forward in the future, there will be like an incentivization around that. And whether that's through something that has an outcome focused or even like pays for care coordination, because like that's such a crazy thing. I was talking with my brother-in-law who's an OB-GYN about the same issue. And he was like, yeah, what you're talking about is a sidewalk consult. And in our world, it just never happens. And it creates all this inefficiency in the system. Not too far off on a tangent, but he was like, I can't tell you how many times I have a client of mine that ends up in the emergency room. And then I end up having to see them for an appointment where it's like somebody could have called me and talked to me for like 5 minutes or less. And I could have been like, yeah, that's a problem with their medication. And it's linked to this recent surgery that they had. So you can go ahead and do this and be on their way. But he was like, I can't take the liability for that. And I don't get paid for any of that. So as a result, it creates this inefficiency. So point of all of it being, it's trying to look for those different things, I think, within mental health that do coordinate care and, encourage a collaborative nature of that.
Yeah, most definitely. Okay, getting back on track. So, and this is actually a nice segue into it. What does good mental health care look like? What can employers do to provide good mental health benefits for their employees?
So I think, that's a good question. And to be honest, I feel like it continues to evolve. And, I think during the pandemic and following the pandemic, we've seen such a huge shift within our field. But from the kind of 10,000-foot view, I would look for places that keep people that have like clinicians that are tenured and experienced and that keep them for a while. Because in the way that I ultimately see our field at this moment is there's kind of the training ground therapist places where they have a lot of people that are younger or earlier in their career, and then they go kind of places, and nothing against them. They're very necessary. Those people are very, they're interested in doing good work. But there's also a difference between that kind of clinician and somebody that has 15 to 20 years of experience. Because like in anything else, like in this day and age, we're talking about AI all the time. And in a similar regard, AI, what makes it good is the amount of training data and the quality of the training data going through it. And so I look at clinicians in a similar light. So the amount of training data that they've had going through them, whether it be through like literally the amount of time and trainings that they've been through, but also the experience of working with clients and doing good work, that's such an important thing. So in my mind, if I were evaluating this is a question that I would be asking of these different contracts of like who is going and building those networks. And, I think it's a challenge just because in our field, there's a supposed shortage of providers. And so I think it can be harder to see underneath the curtain of that. But that is certainly something that employers should be pushing for, is for places that are, and part of what ties into that is good reimbursement models, just because the places that pay less, like I can't say what BCBS Texas pays, but I can definitely tell you there's a lot of people that don't like them in Texas, and it's for a good reason. And it's because they don't reimburse well. And so as a result, like they don't keep up with the cost of living and providers leave. And so that's why they have ghost networks. We actually did an experiment a few months back, and we called from the BCBS directory 100 providers. And of that, around 70%, the information was entirely incorrect. Like the person had retired, the phone number was disconnected, whatever it was, 70% was gone. And then of the remaining percent, around 20% were not accepting new clients. And of the 10% remaining, there were some that were either taking wait list or taking new clients. But it's just like, that's the problem with these networks that are so huge. And they're like 35 to 40% of the market here in Austin, Texas.
Yeah, and try navigating that in the midst of a mental health crisis.
Oh, yeah. And that's the thing that people need to think about for their employees. And that's why, like, personally, that's a direction that our company is pushing in Texas, is trying to provide corporate wellness to companies. And that's something that we started actually with the chief medical officer of Whole Foods. And we were their first mental health partner here. And we did corporate wellness webinars, and we have done corporate wellness webinars for them. We do that actually with Austin Health Partners, which is a variety of different pediatric practices that are in the market. And we also work with Deloitte.
Yeah. And what does that look like? So does that mean a local employer came to you and said, my people are having trouble getting good access. Can we do a direct contract with you? And do you have to be Whole Foods Deloitte sized, or can a 100-person employer do that?
So, that's a good question. And there's different ways of doing that. Something like Deloitte, of course, they looked at it, and it's interesting because from what I know of the data, they had gone and expected a smaller utilization. And like let's say it was 6%, because that tends to be an average number within that realm. And it was a larger amount of utilization than they expected. And it was actually a very popular benefit, just because you don't realize the amount of, it's like you can have so many productive, smart employees, and yet they still need support around stuff. Like, say it's a couple looking at IVF. On its surface, it's like, oh, that's great. They're doing something, they're building a dream, but no doubt that's also one that has a lot of loss and struggle. That's part of it. It's also expensive depending on how companies cover that cost or not. It's one that has so many different ups and downs, plus the hormonal pieces, all these things of you're focusing on how your life may or may not be and trying to stay calm in the process of it. And so that's one of those things that absolutely is a great example of something that people can get support around with a quality EAP service or a corporate wellness product. So how it can look for smaller employers, and what we've actually done, we have some, for instance, we had worked with a law firm here in Austin. We just created a bucket for their people to be able to draw from. So they created a deposit with us. It was something very simple and easy. And we just basically gave them the simplest reporting possible to be able to keep the cost down, of letting them know the number of people that had utilized it in terms of employee numbers, but not giving any identification. And then there's the session count on that. And, we put in place some controls to be able to, moderate that. But it's simple stuff. It doesn't have to be complex or hard. And certainly with the bigger entities, they have more reporting needs. They want things to be for instance, Deloitte is one that absolutely has a lot of reporting requirements and needs, and they want things done in a quick way. And so it depends on the place and their needs, but that's certainly something that, we work to try and help companies with, as well as there are other places that try and do that. Because doing it in a quality way and supporting your employees and having them feel that difference is so tangible. If you've ever called an EAP and you get somebody that gives you kind of a generic script and they're new out of school, you can feel it, and nobody wants that. And so that's why these programs, actually, I think Whole Foods is a really great example. And their chief medical officer, Matthew Lederman at the time, who had written, I think he was one of the people behind Forks Over Knives. He had wanted something that was more qualitative in its approach instead of just doing United, which is who they used at that time. And so even though they paid more upfront, their people were more satisfied and the results were better. And so they continued to keep that program in place even after Amazon, acquired Whole Foods, and it's grown here in Austin.
Yeah. And just to quantify it for people that are like, oh, I don't know that I can afford that. How, is there a certain number of visits that you recommend that they build in, or is there some kind of metric to build into their budget?
So, I think you can also start small. It's I will say some of the normative data that we find in mental health is around 10 or 11 sessions is typically what somebody utilizes in a year. Certainly there's some people that go over that. There's some people but there are a lot that are under that. For instance, with Deloitte's contract, they actually have 8 that are initially approved, and some additional ones can be approved with clinical oversight beyond for that. But they're also trying to see any EAP that's doing a good job is also trying to look at I think differentiate between the type of issues that are there. Is this something where it's addiction and, 4 or 8 sessions or whatever, that's not going to actually cut it. And this person actually needs some really ongoing substantive support in a way. So I think it's knowing that even if you offer 4 or 8 sessions, that stuff actually goes a long way. And, if people, especially if there's something for instance, with Deloitte, we actually go and they call us, and within 2 hours, we get back to them to have a discovery call scheduled for their employee to make sure that it's a right fit. So anyway, and we have their employee in within 2 days. So those are things that certainly places can do, and that's that part of a higher level of care that you can get. Certainly, it also helps if those things encourage that in the reimbursement model. So you have to figure out kind of the different trade-offs within that. Inevitably, there can be a little bit of a pay towards the premium side, but it's if that also helps somebody that's in a bad way, to get them out of that kind of dark place, or that moment that's, when I say dark place, it's I do think that there's the difference of that spectrum. And that can look
Yeah.
it's in having a tough day because of something that happened that's challenging to, somebody that, needs a higher level of support.
Sure. Yeah. And those are great examples of you're paying for it one way or another. Do you
Yeah,
want to add a few more visits or do you want to pay for a very expensive inpatient stay?
exactly. Because those are the things that places are trying to like curtail in this day and age. And I think we're going to see a lot more. And I think because of COVID, we are seeing like a higher need for that stuff. The amount of IOPs popping up all over the place. It's like in our building, we had one that started just a couple of years ago, and now they have like 3 additional locations that have popped up within the last year and a half.
Yeah. And IOP is intensive outpatient program. Can you explain what that is?
Intensive outpatient program. So those are different things where it's like that's another area of some where they try and go and be more efficient with cost. Instead of having somebody do a hospitalization based program, it's something where you can go into a program that's in the evenings, maybe afternoons, maybe mornings. That they have a variety of different things that could be around eating disorders, and it could be around substance abuse. It can be around a variety of different things that people need support. And that way they don't actually have to go into the hospital to get it. It's assuming that that's an appropriate level of care, but it's one of those other things that can help to be able to reduce cost. And we're certainly seeing a large variety of those different things. Like actually a guy that's local here has a company called Self Recovery, and he's a psychiatrist named Daniel Hockman, and he's built this whole online recovery-based program just because he, over the years, had a lot of high-functioning clients that weren't the type of people that were going to go into an inpatient program. And so he went and he built out this program based on evidence to be able to help have something that's private, like, because so many people are scared to go and get help.
Oh,
And
yeah.
so he built this out from his own, doing research as a psychiatrist and best practices with the clients that he had that he's been very successful with. And it's actually not a very expensive program, which is kind of an interesting thing in the field because it's so many times when somebody goes into a substance abuse program and is inpatient, those things can be 30, 50, $70,000.
Yeah. And usually cash, right?
Yeah, insurance it doesn't cover that.
You have given us a lot of tips, though. I'm feeling like even for people that don't have a ton of money to throw at mental health, are there other things that you would recommend employers to do that are even on the budget friendly end to set their employees up for good mental health?
Yeah, I mean, I think part of it is, it's a good question that you're asking, Amanda. And I think that part of it is always being open to feedback from your people.
Yeah.
And that starts with the top of, the messaging that comes from the company and HR and everything that follows underneath it. It's so important. As a mental health practice, I know next year we're choosing plans that allow our people to have coverage for mental health sessions at no cost. And those are different things that you can look at. Maybe it's an Aetna plan that you have that allows that, or maybe it is something like a high quality, corporate wellness product like I've been talking about that gives your people coverage. But I think it's, talking the talk and walking the walk. And I realize not every company is going to like focus on their employees in the same way. For some people, I think they understand. It's like I had a friend that worked in fast food and he owned a number of different locations. And he was like, Billy, the average like normal entry level person lasts 30 to 45 days for me. An average store manager lasts, 90 to 120 days. So he was like, we're constantly juggling. There's just no way. He was like, it's an unfortunate reality, but like, and the nature of this, people are somewhat disposable and like, which is a tough thing for any employer to say, but it's like, there's just so much churn that inevitably happens in that field because people do go through it very quickly just because the cost doesn't keep up with the cost of living for very long. And so I think it does depend on the employer and kind of what their different priorities and needs are. Like, for instance, that law firm that I mentioned, that was something that helped them to be able to support their different employees that were going through some struggles. And inevitably, sometimes you'll be surprised, but it's like we see so many really bright, high functioning people that utilize these services and it helps and goes such a long, long way. And it's not to say that I don't think there's a reason not to support others. I think it's always a great thing to be able to have for your employees, just because at the end of the day, the more happy and supported your people feel, that's the kind of thing that shows up in all the ripples of your company, how they interact with your, potential clients, how they interact with your current clients, how they interact with each other, how they, leave Glassdoor reviews as to their experience of having worked with you. That helps your recruiting. So I think it's just thinking of all of those things that are the layers of support for your people beyond even just the initial cost drivers of that. It really goes a long way to helping them feel like they're a part of something bigger, and that means they stay longer, they're more loyal, they work harder, all of that stuff. It has an impact on your bottom line, and that's important.
Yeah, most definitely. And I know everything we've talked about today has been related to ROI and mental health, but I'm going to say this out loud just because it needs to be said. It's also just the right thing to do. Just take really good care of your people. And no, it may not make sense for a fast food restaurant, but you know what? Those Glassdoor reviews matter. They matter in attracting that next person. And yeah, I don't
I
know.
think every business is important to look at it and figure out the appropriate levels for your needs. And, my hope is that, we'll see more of them do that. And you see those things. It's so interesting. Like even before, like Nebraska Furniture Mart's about to open here. And even before they come in, I've heard all of these things about what a great company they are to their employees. And it's interesting, like that this company isn't even here yet. And yet we're hearing these stories of like, yeah, they really take care of their people. They do, they have great benefits. There's just all this stuff. And it's like, they're a year out. And so it's that reminder of like, I know my focus on Nebraska Furniture Mart is that hopefully they'll have some cheap and good furniture for and stuff. But like, absolutely, do I look at that and then think about that in comparison to IKEA or any of the other places that we might go for buying and outfitting our offices or even our home? That stuff becomes something that can feel very tangible and personal. And so I can absolutely imagine that as people are considering like, where do I want to work in a competitive work environment, these things come into play as well.
Yeah, absolutely. Well, Billy, you've shared so much good information. Any last pearls of wisdom you'd leave employers with?
I think I would just say I think it's good to look at the different ways that their people can feel supported, and I realize, I'm coming at this from a mental health perspective, but that can mean so many different things. Like I know for our company, we have like breakfast, we have lunches, we have little happy hours. Those things all build support and community and connection. There's but important things. It's like we have cupcakes on people's birthdays to like we have, you know, because breakfast tacos are kind of a big thing here in Austin. We have breakfast tacos, coffee, and flu shots actually, like as a drive that we do. And it's something that helps to keep our people happy and well. And, at the end of the day, I look at the flu shot in kind of a similar way of here's this thing that I can do to invest in our, employees' health. Because the more like healthy they are, the less days they miss at work. It's an inoculation in kind of a different way, but you could certainly say the same kind of thing about mental health.
Yeah. You're creating belonging and you're reducing absenteeism and doing it at the same time. I think that's brilliant.
Yeah. Cool. Well, Amanda, it was really nice talking with you.
Yeah. Thank you so much for your time and thank you for all the passion that you put into mental health.
Yeah, absolutely. And if anybody wants to learn more about us, our website is justmind.org. And we also have blogs on there with a lot of different evidence-based and research-based tips from our therapist for the community.
That was Billy Schroeder with Just Mind Counseling. Here's the bottom line for employers. Ignoring mental health is not neutral. It shows up as turnover, burnout, absenteeism, and disengagement. And quality matters. Fast access, evidence-based care, and support that's actually usable by real employees with real schedules. If you're in HR, finance, or leadership, and you heard something today that made you think, we're not doing that yet, this is your signal to start. Thank you for listening to the Generous Benefits Podcast.